Thank you, Amy and Brittany. This brings us to our next segment, treatment and containment of the measles virus. Measles can be prevented with measles-containing vaccine, known as MMRV, which stands for measles, mumps, rubella, and varicella. It can be used from the age of 12 months through 12 years, and it is known as a multiple antigen vaccine because it covers multiple viruses. One dose of MMR vaccine is approximately 93% effective, and if a second one is needed, it is 97% effective. The MMR vaccine contains weakened versions of live measles. The vaccine works by triggering the immune system to produce antibodies against measles, mumps, and rubella, as shown in the right-hand diagram on the slide. If you or your child come into contact with one of the diseases, the immune system will recognize it and immediately produce the correct and effective antibodies needed to fight it. It is not possible for people who have recently had the MMR vaccine to infect other people. There is no specific antiviral therapy for measles. Medical care is supportive and helps relieve the symptoms and address complications such as bacterial infections. For children who contract measles, they should treat with vitamin A and should be administered immediately on diagnosis and repeated the next day. The recommended dosages are below. For post-exposure prophylaxis, so in the event that you are exposed to the measles, people who cannot readily show that they have evidence of immunity should be offered post-exposure prophylaxis and excluded from this whatever setting they are in, be school, hospital, or childcare. MMR vaccine, if administered within 72 hours of initial measles exposure, or immunoglobulin, if administered within 6 days of exposure, may provide some protection or modify the clinical course of the disease. An interesting factoid that I learned while doing this presentation, in the decade before the live measles vaccine was licensed in 1963, the average of 549,000 measles cases and 495 measles deaths were reported annually in the United States. However, it is likely that on average 3 to 4 million people were infected with measles annually. Most cases were not reported. Of the reported cases, approximately 48,000 people were hospitalized from measles and 1,000 people developed chronic disability from acute encephalitis, which is a buildup of fluid in the brain caused by measles annually. Down at the bottom of this slide, it shows that graph. Thank you for viewing our presentation on measles, and have a great day.